Welcome to part 2 of our beatdown of loser McCain-Feingold in response to her healthcare reform Americans in London video. To begin where I left off, 86% of fire departments are volunteer or mostly volunteer and protect 39% of the population. We have to ask, where is McCain-Feingold getting her information? If a burglar attempts to break into my house, the people who come over to clean up the mess are probably a few state troopers and a few local cops along with the county coroner, not some schmuck from the federal government. In addition, cops and firefighters are at the most a state entity, not a federal entity. I don't think McCain-Feingold understands what federalism is. This lone person using a distorted voice also had the following zinger. She said, "What if your mother is raped, but the perpetrator gets away? Is your mother to pay for all the expenses of having been victimized? What if she's retired and on a fixed income? How about if she's badly injured in the assault and requires $290,000 in medical treatment and is uninsured? Since nobody owes her a thing by your rules, she should be left to die or live in agony, right?" End quote. What percentage of all healthcare cases are like the above scenario McCain is through? About 0.000000001%, I'd figure. Do you have any studies to back up your fact that this extreme case is the norm? What McStupid is arguing here is akin to the following. Let's ban all airplanes because sometimes someone gets on board with a bomb or a gun and blows it up, or flies it into a building. Sure, if we banned all airplanes, the likelihood of another terrorist attack goes to nearly zero, but would that be a good result for the population en masse? I don't think so. One of McStupid's friends, this person, this was this FKA that wears a snot rag across his face. One of McStupid's friends did, in fact, try to provide some evidence that lack of health insurance is causing people to die in droves. This troglodyte was cutting and pasting the same thing over and over, saying, people die because they don't have access to necessary health care. Even some people who do have health insurance coverage die because the greedy bastards refuse to provide coverage. 123 people die every day because of that, and die every time was in caps to make this argument. Ooh, even more powerful. And then she also said, or he, I don't know what it is. I can't figure it out. You tell me, big old Adam's apple, you know. It also said, what if those 123 dead Americans had been killed by someone named Mustafa? Take one, end quote. It went on and on, though, folks. 123 times 365 is 44,895. I asked this person repeatedly who commissioned this study and never got an answer. It's all in the archives. Check for yourself. I asked several times. This man finally directed me to Alan Grayson, saying he has all the information. This leads me to believe that this person was parroting a talking point without checking it out. That's funny. I remember a study coming out commissioned by Physicians for a National Health Program, and it appeared in the American Journal of Public Health in December 2009. This parrot obviously has done no background research on this claim, and there are several flaws in this study. The study subjects were interviewed only once, and the study tries to link their insurance status at that time to mortality 10 years later. Yet over the decade, the authors have no idea whether their subjects were uninsured or insured, what kind of medical care they received, or even their cause of death in most cases. As you'll find out, a lot of them, a lot of the study members in a different article they found died from various things. We'll get to that shortly. The study fails to recognize that being uninsured is like being unemployed. It happens to a lot of people for brief periods. Most people who are uninsured can get insurance within 12 months. Being uninsured 10 years ago is no more likely to cause you to die than being unemployed 10 years ago. In addition, it was the FDR administration that took us on the road of employer-provided health insurance by enacting wage freezes and purposely leaving a loophole and tax break for companies to offer their employees health insurance. It's a great idea until you're in a recession. The tax break should be given to the employee. It should be portable. I don't know what that was. It should be portable. If you lose your job, you don't lose your insurance. And we should be able to purchase health insurance across state lines. That way, people in New Jersey are no longer held hostage by community rating, guaranteed issue, and other provisions that cause premiums to go up markedly. There are other flaws in this parroted study. The uninsured were oversampled, and insurance status has little to no impact on participants who die violently, as these persons would get emergency care, which is not dependent on health insurance. If the 4 excess deaths we identified were from violent causes, then there would be no underlying correlation between insurance status and early death. We can identify 40 persons who died from motor vehicle accidents and 11 persons who died from suicide by firearm. Having health insurance or lack thereof is going to make no difference if you put a bullet in your head. Lastly, we've asked McCain-Feingold repeatedly to cite where the U.S. Constitution gives the federal government the authority to compel me to buy any product, in this case, health care. She has not answered. We have one last question for McStupid. Since she believes more government is a solution, can she name for us one government program that was on time being implemented and on budget? For every one she names, we'll name 2 in response. Have a nice day, and don't thank me now for correcting you, McCain-Feingold. Again, McCain-Feingold parroting flawed arguments, her friends parroting flawed arguments. And, well, it's just basically short, generalized claptrap as per usual. But when you dig down in the details, you'll find McCain-Feingold has no idea what she's talking about. No need to take her serious.